Welcome to another episode of Youth Diary. Sexually transmitted diseases are infections that you can get from having sex with someone who has the infection. It spreads from one person to another through intimate contact. So let's know more about it. So we have Dr. Faizal with us. He's a consultant dermatologist from Ernakulam. Hi Doctor.
Hi.
Welcome to our show. Doctor, can you just explain what are sexually transmitted diseases?
See, sexually transmitted disease is also known as venereal disease. This, it can be caused by bacteria, virus, or fungal.
Okay.
There are many. There are different types of sexually STDs.
Okay.
This more common. It is gonorrhea, syphilis.
Okay.
Donovanosis, LGV, lymphogranuloma venereum, and human genital warts,
Okay.
herpes progenitalis,
Okay.
HIV, all are sexually transmitted diseases.
Is it spreads only through an intercourse or some other way also?
No, it's most commonly it's spread through the transmitted through the sexually contact only.
Okay.
But it can be transmitted through the skin to skin contact, blood to blood contact.
Okay.
Even it can spread from infected mother to baby through the placenta during the pregnancy.
Okay. So it's not only through the sexual
contact. Yeah.
I think our friends have got a few doubts.
Yeah. Okay.
Let's move on to that.
Hi ma'am, I'm Meera from Dublin Healthcare. Is there any possibility of getting STD from a non-sexual intimate contact?
Yeah, most commonly it will be spread through the sexual contact only.
Okay.
But it can spread through the other route also, like skin to skin contact, blood to blood contact.
Skin to skin contact means
The rubbing together that infected persons that can be rubbed.
Okay.
Then that like that.
If there is any wound on the skin
Yeah,
or
yeah.
something. Okay. And then what are the other ways, Doctor?
Blood transfusion.
So
From
is
the
it
blood
possible to get through a blood transfusion? I mean.
Yeah, HIV will be transmitting through the blood transfusion.
Oh, will it be present in the oral secretions?
Yeah,
So that means
that it's chances are that if there is any cut wound and all, it can be, and the herpes labialis can be spread from the kissing and so.
okay. That means if a grandfather is having an herpes labialis at home,
Yeah, if
what are the
he's
chances of getting
there are chances of getting
infection to
to the kid.
Okay. So we'll move on to the next question.
Hi ma'am, I'm Sri Priya, working in Dublin Healthcare. Ma'am, is there any chance of getting STDs from toilet seats?
Actually, there is no chance to get STDs from the toiletries, but it can it's very rare.
So sharing a public toilet or
Yeah.
it's not at all.
Yeah, it's
So doctor, what are the chances of getting an STD by sharing bath towels?
say some parasitic infections like pubic lice,
Okay.
scabies can be spread through the
Sharing of that,
sharing the towels, bed sheets, and clothings and
Okay.
all.
Doctor, one more doubt here. I've seen most of the guys sharing razors.
Yeah.
So is there any chance of getting STDs
Yeah.
through that?
Yeah, that should not. That can spread the STDs.
Okay. Is it mainly through the blood?
Blood, yeah.
Okay. So doctor, the scabies, is it a sexually transmitted disease?
Actually, it's not. It's a communicable disease, but it can transmitted through the sexual contact also.
So when we go to the sexually transmitted disease, can you just explain me what are the symptoms of sexually transmitted diseases?
Usually, the venereal disease, most of the venereal disease will not have any symptoms.
Okay.
So the patients will neglect it.
Okay.
So in some cases there will be some burning sensation while passing urine.
Okay.
There will be some discharge from the unusual discharge from the vagina or penis.
Okay.
And there can be maybe some ulcers
Okay.
on genitalia.
Can it be a painful ulcer or a painless
Yeah,
ulcer?
usually it will be painless ulcers.
Okay.
So the patient won't take
Seriously.
will not take seriously.
Okay. In your practice, what is the most common sexually transmitted disease?
It's
like that?
in our Kerala. It's very few. It's very rare.
Okay.
So, but it's only herpes progenitalis and genital warts, gonorrhea, all are slightly common
Okay.
in our stage.
And what about this chlamydial infections in females?
Yeah, it's because of the good hygiene.
Okay.
It's very rare.
So how do you manage a sexually transmitted disease, and what are precautions that you ask the patient to take?
It's awareness. This is the first step. The patient should that avoid sex with multiple partners and avoid sex with unknown person and have only one partner.
Okay. What about the contraceptive methods, doctor?
Condom.
So, doctor, we'll move on to the next question.
Yeah.
Hi ma'am, I'm Pinky from Dowling Healthcare. I have a doubt. Can a person get STDs from a virgin?
See, if the person is infected, even if she is virgin or not, she can spread that disease can be transmitted.
How, doctor?
There are different. I told now that even that mother can spread, that baby can get the infection from the
Mother or grandmother.
And virgin, other route of other type of anal sex. If she is having anal sex or oral sex, she can have the sexually transmitted disease.
Okay. So it's not.
And not only through the penetration of the.
Okay. It's not necessary that they should have after intercourse. They should have these diseases. They can have this type of diseases even
Any
after
sexual.
oral sex or an anal sex.
Yeah.